Good morning. It is Tuesday, July 13th. I'm Jessica Lovell. Welcome into the Morning Medical Update. Today we are talking about getting back to life. Like always, of course, we are talking about COVID-19. Then we'll give reporters a chance to ask questions and then introduce a short health topic so that you will have time to ask your questions and get those over to Jill. So today's health topic, the Kansas City Pink Warriors. They are back on the water, no longer landlocked during this pandemic. We're going to show you how this dynamic group of breast cancer survivors is getting back on track and with a new look. But first, we start with the COVID count. Let's get straight to Dr. Hawkinson. Good morning to you.
Hi, how's it going?
Good, how are you?
Good, good. You know, our numbers are creeping up a little bit. Unfortunately, we were at 26 yesterday. Today we're at 28 active infections, with 8 of those in the ICU and 2 of those on the ventilator. We still have 10 additional people who have met that criteria for recovered. So we have a total of 38 patients in the hospital. Hays has 1 active patient right now as well. So the numbers are creeping up, unfortunately. Currently at the hospital, we don't have any capacity issues as far as nursing, respiratory therapists. We don't have any capacity issues as far as ventilators or vital drugs or therapeutics, but we're always at the ready. We know what is happening in other parts of the nation and other parts of our region.
All right, so stay right there because we want to thank our viewer, Catherine, for bringing this back. This is the Swiss cheese model. You remember this, right? So, Doc Hawk, just kind of walk and talk us through it, kind of why this image helps us better understand COVID spread and why wearing a mask, distancing, doing all the things, and of course how vaccination ultimately just works.
Yeah, so I think that's the key, is it's not one thing. There's not one panacea, but it's a combination of things. And it starts with those non-pharmaceutical interventions such as masking, as distancing, as hand hygiene. And you get down into that, doing things outdoors, anything you can do to help reduce that exposure to the virus. And then ultimately, we are getting to vaccination. So all of that combination is going to help, and especially now as we see the further spread of the Delta variant, especially even much more in those unvaccinated areas or those areas where there is lower vaccine uptake in medicine right now.
Dr. Hawk, thanks so much. Okay, before we start our conversation, any reporter questions on the line today? All right, jump in if you have one. Doc Hawk, of course, we're listening, gathering community questions right now as we speak. So get those ready, get those in, stay close. We'll get back with you in just a moment. So it has been a long year for many of us, stuck inside, social distance from friends and family. But for the Kansas City Pink Warriors, 2020 interrupted training for their official Dragon Boat team. We met up with them last year. This was just right before the world shut down. I think we're going to pull up some video of them exercising. So the Dragon Boat racing team is a canoe racing sport. These ladies sit side by side, moving as a team, but their love for the racing isn't all they have in common. These are all breast cancer survivors. One team member was diagnosed shortly after having her youngest daughter.
A lot of statistics say is breastfeeding moms that it reduces the risk of breast cancer. It was my 4th baby, so it was a complete shock. Having to wean her and prepare myself and my family, you know, all my kids. I had at that time almost 13, 11, 5, and a little one for, you know, the throes of cancer was really difficult. But it gives you more of a reason to fight, and we got through it together. And I think it put a positive perspective on something that could have been a lot scarier.
So let's meet our guest today. In studio with us is Dr. Richard Horintager. He's the chair of plastics here at the health system. And also joining us by phone at Wyandotte County Lake is Betty Welch and also Heather Siebel, both members of the Kansas City Pink Warriors Dragon Boat team. So good morning. So good to finally see your faces and hear your voices again. Before we get into our conversation, Heather, first of all, good morning. And just tell us what Dragon Boat racing is.
Good morning, Jessica. Dragon boat racing is a team sport that originated in China over 2,000 years ago. It, as you said, a canoe-style sport. The difference is we have 20 paddlers in our boat. We have a steer person on the back, and we have a drummer in the front. The main aspect of the sport is that we race together, and we do everything together. If we are out of sync with each other, then we cannot win races. So it is very much a team sport that focuses on togetherness and synchronicity and just, yes, that's what it is.
So, Betty, so just kind of the question we have to ask is, how did COVID impact your team and ultimately your practice?
Well, as you know, the world shut down, and so did our practices initially. We do winter workouts with Kelsey, and those ended up being on Zoom meetings. And then our practices, we stopped for a while, and then when it got safe, we went back with just 5 people paddling and the steer person and the drum, and just had to take several sections out with masks, social distance, and that was the only way we were able to get back on the water. But it took a while for it to get to that point.
Well, yeah, it's kind of hard to social distance there on that boat for sure.
Right.
Heather, yeah, so we came out to see one of your workouts last year. This was literally just days before everything shut down. How did you stay connected? Yeah, check out that video. I mean, you haven't seen that in a while, right? How did you stay connected? How did you stay in shape? When you couldn't get together, I know you really rely on kind of that camaraderie when you're working out and kind of pumping each other up, but how'd you do it when you were on your own?
Well, luckily for us, Zoom, as it did for everybody in schools and everything else, we went to a Zoom workout where Kelsey was at the gym. We were all at our individual homes, and we still worked out as a team, but separately.
And Kelsey's one of our trainers.
The best you could on your own to stay in shape.
Yeah, and I know Kelsey works with your team. She's one of our trainers with the health system. I do have to ask, did anybody get COVID during this past year on your team?
We had some people on our team that got COVID outside of our team with the things that we had in order for our team, with the masking, the social distancing. We did not have any cases of COVID that were traced back to our team. So anything that happened was kind of outside. Those people obviously did not come to practice. We all are very good at taking care of each other, being cancer survivors, and knowing that we were at a higher risk. So we took good care of each other if anybody was having even the slightest inclination of sickness.
So, Heather, let's switch over to some exciting news. You have a new dragon boat. When I first met you a couple years ago, you guys were borrowing a boat, and your big goal was to get your own gorgeous dragon boat. Tell us about it. Tell us what it was like when that hit the water for the first time.
Mm-hmm.
It was amazing when it hit the water the first time. I think right now people are seeing when our boat first pulled into the marina. Our boat was originated. It was designed in Germany. It was made in China. It is a Pei Sheng style boat. It is 40 feet long, 4 feet wide, and approximately 400 pounds of pure power that we get on the water. Many dragon boat teams wait years and years to be able to purchase their own dragon boat, but through the support of the Kansas City area, through support of people directly related to our team members, people who didn't even know our team members, we were able to purchase our
one day, one moment, 1 hour at a time, and try to find the positive and set goals, look forward, and know that diagnosis is not an ending, and that you can get through it and have your support and your medical team, and look for the cup half full.
And for me, this is Heather, I listen, all of what you are is only a part of who you are. And I try to make it the smallest part of who I am as possible, even though I do think about it every day. I like to have things to look forward to. I like to keep myself busy. I like to keep myself physically strong and mentally strong. And I like to surround myself with a good group of positive support. And KCP Warriors has been a huge source of support and positivity for me.
All right, little technical difficulties. We're going to get back to the ladies here in just a moment, but I want to bring in Dr. Richard Horintager. So glad you are with us today. You are the chair of plastics here at the health system. So you introduced me, Dr. Horintager, to the Pink Warriors because I know they actually really inspired you. You were like, I have this great story to share, and I was so glad you introduced me to those ladies. So how are you medically working with them? What type of procedures? Walk us through that.
So as plastic surgeons, what we're involved with is the reconstructive side of their treatments. We work closely with the breast surgical oncologists and sort of the entire breast team. And what we're able to offer at KU is sort of the full spectrum of reconstructive plastic surgery for them. In many cases, it will start off utilizing what's referred to as implant-based reconstructions. One of the big changes that we've made over the past number of years is moving to putting implants on top of the pectoralis or chest wall muscle. That actually is a really big deal when we're talking about things like the Pink Warriors, because it allows the chest wall muscles to be in their normal position and not be impacted in terms of strength. The procedures as we sort of go forward, one of the things that we're very proud of is our free tissue transfer program, what are called DIEP flaps or PAP flaps is another type that we'll utilize. These are operations that are able to take blocks of tissue from different areas of the body with minimal impact on the muscular strength. So it gives the patient, it gives these ladies the best opportunity to get and to keep as much of their strength of those muscle groups as possible.
So how did COVID regulations change how you operated, but also really provided the care, the follow-up care for patients during that time?
Well, during COVID, what we did was we continued to perform essentially all of the procedures for the acute cancer diagnoses. We were putting off procedures that we would sort of think of as maybe touch-up procedures or things to improve some of the final cosmesis or aesthetics of the reconstruction. But throughout the time, both we and sort of the health system are always primarily conscious of making sure that we were doing things in a safe way. Many of the women are going to be in immunocompromised states, so we had to be extra careful and make sure that anything we did didn't have any untoward impact on their treatments going forward.
So these women, as we've been showing you this video of them flying across the water, they're using that upper body strength. You've always told me that's really crucial for them, is getting that range of motion back. You might think somebody who's had that type of surgery needs to take it easy, but you're saying the more they're doing this type of motion is actually better for them. So kind of what advice do you have for patients if they're not on the Dragon Boat racing team? What can they do at home?
Well, what we always will do is, we have to break it up into different periods of time. So early on, we are going to have certain controls where we're going to be requesting that they maybe do gentle range of motion exercises to keep their shoulders, elbows, upper bodies moving, but we're going to stay away from heavy lifting or real training activities sort of to build up those upper body muscles. But even during those early times, we're encouraging people, they're up walking, they're doing lower body work, they're keeping up their cardiovascular activities. And then as we go further along, often 6 or 8 weeks and further, the patients are being encouraged to do as much as possible the normal activities that they would have otherwise done. Occasionally, we're going to need to get the physical therapist involved, an occupational therapist, but most of the time, the women are doing a tremendous job of doing this, sort of on their own. And then things like the support groups and Dragon Boat, this is a remarkable example of a support group. They really feed off each other and just do amazing work.
All right, we're going to get to your community questions here in just a moment, but I want to go back to that video of our Dragon Boat ladies because I love seeing it. So inspirational. Really, Dr. Horintager, just kind of what's your message to them? Because what they're doing is pretty extraordinary. I mean, they're really kind of they're really giving women, I think, a voice of kind of what they're going through and to get out there and have that camaraderie and get back to life.
I think, essentially all of these women, I don't think any of them were dragon boat racers prior to this. So this is a great indication that, what we like to talk about is a new normal. We can't get you back to where you were before, but that new normal can actually be as good. It can be healthier in many ways than it was before. So if you can use this as an opportunity to sort of think about how limitless you can be and have a willingness to try new things, I think it can be a very positive impact on your life.
Yeah, these women said limitless. That's a really good way of saying it, because these women said that breast cancer diagnosis, the worst day of their life, led to really what's turned out to be the best times of their life. So thank you for introducing me to that story. I'm glad we could bring those ladies here today. As promised, of course, we're ready to take community questions. Jill, let's get started.
Yeah, we have a lot of them, and many of them are COVID, but we do have one on topic, or a couple. One of them is Laura wants to know, Dr. Horintager, have you seen a higher rate of breast cancer during COVID or since COVID?
So actually, my breast cancer colleagues, the medical and surgical oncologists, would really be the best ones to answer. What I can say is that, unfortunately, especially in certain groups who have been more concerned about coming into seeing their healthcare providers, it appears that there may be some evidence that there's some delay in treatment in some cases. But overall, I'm not aware that there's been an increased overall incidence in the development of breast cancer as a result of COVID. One thing I would say is that there is clear evidence, though, that increased weight beyond what is healthy does increase your risk of breast cancer, because it increases the estrogen in your body. So that may be something that over time we find has had an impact.
All right, thanks. Let's get to some of the COVID questions and keep sending your questions in. The first one I'm going to give to Jean. Hello, Jean. Good morning. Is there any evidence, Jean asks, that the vaccine affects female fertility? He says, we have a friend who is fearful of vaccinating her teenage daughter for fear it will affect her fertility.
No, unfortunately, this was another misinformation campaign about the vaccine. And we've also heard from our OB-GYN colleagues, and also Dr. Alt, who is on the ACIP committee, who, infertility is not a new misinformation campaign about vaccines in general. But there is no evidence right now that the COVID vaccines cause infertility or problems with that. It is still recommended by all of the OB-GYN societies to offer the pregnant women and those who are trying to conceive the vaccination. So there is no truth to that. That person would be safe to get it. Obviously, I've given it to my young daughter, so there are no concerns about infertility with the vaccines.
Okay, and his follow-up question is, what do you think about France plans to require proof of vaccine to attend events?
Yeah, again, these are kind of issues that we don't really get into too much. We do continue to endorse, and everybody should be getting the vaccines. As far as government agencies or private entities requiring or mandating proof of vaccination, that's certainly up to them. We do know that overall people are safer. Areas are safer when more and more people are vaccinated, and kind of that's what our stance has been. I don't know all the full details of that, so certainly would have to look into that. But continuing to really strongly encourage, and then if it is up to those private entities or those government entities to mandate, that's certainly within their purview.
We have more than one person asking if we know how many patients are overspill or transfers from Southwest Missouri.
We had some information from that yesterday. Let me see. I think we had maybe 2 that were transfers from that area, at least for COVID. We also people are in that area are also trying to transfer for other typical reasons that they just don't have capacity for that they can normally take care of. But I think as of yesterday, we had 2 transfers for COVID specifically from that area.
Okay, and Jamie asks, good morning, doctors. Went to Springfield Sunday, very little mask use. Should the mayor, again, another kind of policy question, not in our area, but should the mayor make a mandatory mask mandate with the virus to get it under control?
Yeah, I think when you are these entities, particularly government entities in whatever region you are, there are more things to consider, and we have talked about this. There are economic things to consider. But obviously us being in healthcare, the most important thing for us is healthcare. That's what we continue to focus on. Can we make that statement about should there be mask mandates? I think when you're talking about the health of your people and your constituents and everybody around you, I think everything needs to be on the table, and those need to be thoughtful discussions with those policymakers, those legislatures, to really determine what is the best for everybody. Aside from that, I think you as an individual also have to understand what are your risks when you're doing certain things, going certain places. So understand your risks. Obviously, if you're vaccinated, you're going to be significantly protected from hospitalization and severe disease, even with Delta variant. However, if you feel unsafe, or if there's a reason that you think you need to wear a mask, for instance, if you get ill, then you have to miss work, then certainly do those things. But always take that risk assessment and really understand what is that situation I'm going into. Do those people, are they all fully vaccinated? Do I know who they are? Obviously, if it's your family, you have a little bit more control over knowing who is vaccinated and who isn't. But I think there is that the policymakers and the legislatures having those thoughtful considerations, but then you as an individual can also do those things that make you feel most comfortable. And certainly wearing a mask, continuing to distance, doing things outdoors is always going to be safer right now than doing the opposite. But most important is obviously getting vaccinated.
Isaac wants to know, he said yesterday he read something about cases of, and I will say this wrong, Guillain Barre? Mm-hmm. Did I say it right?
Yeah.
Oh, good. I used to call it Guillain Barre, so I'm doing better. Guillain Barre, resulting from the J&J vaccine. I'm sure anti-vaxxers are all over that, he said, saying, I told you so. Mm-hmm. Can you put that into perspective for us?
Yeah, there's not much information right now. What I saw in one of the reports was that there were about 100 or so cases out of 12.8 million doses of the Johnson & Johnson vaccine. I think what we have to remember here is that per the CDC website, there are about 80 to 160 cases of Guillain Barre per week. Just in general in the United States, I know myself a few weeks ago, I did see a case of Guillain Barre. But Guillain Barre is caused by a number of different things. Basically, it is an attacking of your nervous system. Most of the time it's transient and people do recover from it. But it can happen because of infection, such as with Campylobacter, which is a bacteria you can get from eating contaminated food. It can happen from influenza. And we saw way back in 1976 when they had the swine flu vaccine that they saw 1 to 2 extra cases than they would normally see per week because of the influenza vaccine itself. So there are a lot of different entities that can cause this Guillain-Barré. Right now, the risk continues to look very, very minimal, and that risk does not outweigh the overall benefit of the Johnson & Johnson vaccine. Obviously, we're still waiting for all the information, but again, in the United States alone, without this, normally see 80 to 160 cases per week, so this is nothing new, and many, many different things can cause it. I would still say that the benefits of the vaccine far outweigh this risk.
How long does that last, or can you describe what it is? I'm not even sure I know what that is.
Yeah, you basically have a loss of sensation and feeling starting from your legs and moving up to your up through your body. How long does it last? It's most of the time it is transient, so it does resolve on its own, but it could take time from a few days to a couple weeks. Again, most of the time it's transient and does resolve, so it doesn't result in any permanent damage.
Peggy asked, can you give an update about the vaccinated inpatients and if they had underlying conditions, those
Yeah, I
breakthrough
think
cases?
we talked a little bit about that yesterday. We did get some more information. All of those patients that were vaccinated were symptomatic and have the disease. Again, for the most part, were in that older age group, and they did have things such as diabetes, obesity, coronary artery disease, lung disease. So there were significant comorbidities associated with those patients. But again, the vast majority of the patients that we have in the hospital were unvaccinated, including the patient in their 30s in the ICU who was unvaccinated and otherwise healthy.
Okay, Fanny writes that she's been vaccinated since February 4th. She got the Pfizer vaccine. She goes, I'm on the road in a variety of long-term and acute facilities. Am I safe?
Yeah, you're safe. Vaccination, even the vaccinations we have right now, even against Delta variant and the other variants that we've seen, the Alpha variant, the Beta variant, which I believe was the South African variant. The vaccinations we have all provide protection against all of those variants, and it provides protection against the whole spectrum of disease, from asymptomatic to mildly symptomatic, and of course the most important is that hospitalization and severe disease. So you are protected. Again, if you are going into places and otherwise feel uncomfortable, you're certainly welcome to continue to wear a mask and distance as much as possible as well.
Okay, 2 more questions from here because we're coming up on the half hour. Deb says she wants to know 2 things. How many vaccinated are in ICU, sick, and then can you help people understand this is an uphill battle?
Yeah. So the latest data we have was from yesterday in our ICU patients at that point in time. Again, there were 2 in the ICU that were vaccinated. Those patients were older, 60 or older. They did have significant comorbidities, significant heart disease, lung disease, diabetes, obesity. So that certainly aided in their need for hospitalization and their symptoms. How much of their symptoms are also due to maybe some of those other things that were exacerbated by the COVID infection, by the SARS-CoV-2 infection or COVID-19. Is it an uphill battle? It is. When you see what's going on in Southwest Missouri, when you see what is happening in Arkansas, when you compare that to what's happening or what has been happening in India and understand the supply of vaccines that we have here, but there is still such a low uptake, there are people that would do anything they could do in those other countries, such as Peru, other countries in South America, India, to do what they could do to get their hands on a vaccine. We have a glut of supply right now, and people are still politicizing this, still do not want to get vaccines, even though it will protect them individually and overall will help protect their community. It is an uphill battle. We still have to continue to answer these questions and continue to endorse vaccination because we know what will keep us individually safe, will keep our employees safe, will keep our patients safe, and overall what will keep our community safe. So we just have to keep answering these questions, keep endorsing vaccination, because this is a way that we are going to be able to continue to get out of this, keep our economy running, keep our restrictions lessened, being able to do those things that we want to do, being closer to 2019 than we were doing in 2020.
And last question is, do you have any update on Novavax?
Well, I don't have any update other than what was produced in the New England Journal of Medicine a couple weeks ago. Again, it's going to be one more piece of vaccination that we can use, one more thing in our armamentarium to help prevent COVID disease. So we are working on that. We'll see what they do. No new information other than what was produced in the New England Journal of Medicine a couple weeks ago. But it does look to be safe and efficacious, so hopefully we'll hear some information about that soon.
Thank you. That's all I got, Jess.
All right, Jill, thanks so much. Great questions again today. Dr. Hawkinson, quick media question. Betsy from KCTV5 is asking, do the breakthrough patients have anything in common that would explain the vaccine not taking?
Mm-hmm. Yeah, I think we mentioned a little bit about that. And it is, it's the comorbidities, age, obesity, diabetes, heart disease. Some of these issues, lung disease, may have been exacerbated by COVID-19 as well. So that is the main thread that is going through these vaccinated people who are still coming to the hospital and having that severe disease. Again, it's not 100%, but it is significantly reducing the amount of people in the hospital because those people are vaccinated. And again, it's who we are not seeing. And those at highest risk of infection and severe disease, those nursing home patients, which we are not seeing because many of them are vaccinated. So, and that is true because what we are seeing in the hospital is 75% or more of our patients in the hospital are unvaccinated.
All right, thank you for that. We're going to get to final thoughts in here in just a moment, but we did it. We want to take just a few seconds for a few bragging rights as we wrap up today. We are happy to announce the University of Kansas Health System edged ahead of Nebraska Medicine in our Step into Summer Wellness Challenge. Just by over 8,000 steps. Every step counted. The challenge was to promote good health by showing how just adding a few steps a day can really make a difference. The step count reflects the average number of steps per participant over 28 days. Now, Nebraska Med edged ahead a few times during that month, but in the end, we pulled it out, promoting wellness, yes, and then that $1,000 wager that we had going, those proceeds are going to go help the Hope Lodge here in Kansas City, helping to serve our patients and their families. So job well done to all of our walkers out there. We want to get back out to our warriors today. I want to get some quick final thoughts from them. Betty, thank you for joining us. Just some quick thoughts about just staying safe, but also getting back to life. Did we lose our gals? All right. Is Betty with us or? Let's get final thoughts from Dr. Horintager. How are you? Okay, so just final thoughts. We've been talking about kind of getting back to life, but what's your message to the community about doing that, but also folks, or patients, about also staying safe right now?
Well, the most important thing is everything that Dr. Hawkinson was talking about. The best shot that we have of not only keep the patients themselves staying safe, but us doing it for them as a community, which I think is our obligation, is to get vaccinated. That's the best thing that we can do. Be sensible about, how we are going about having fun during the summer, indoors and outdoors. And just, for the Dragon Boat ladies and the whole Dragon Boat, we're super excited to see them in competition. We're going to support them every way that we can, and I'm hoping to get into the boat myself and probably be shown up badly by all of these ladies with all the great work they're doing.
That they said they want to get you out there. Put some muscle into it, Dr. K.
Oh, well, I'll do my best.
Okay. All right, Dr. Hawkinson, final thoughts today.
We see Delta variant spreading. We know it's the most common or most dominant variant in the area right now. We can still protect each other from hospitalization, severe disease by getting vaccination. The vaccinations are safe. They are effective. Their benefits significantly outweigh any risk, so please continue to get vaccinated, and we'll keep you updated on our numbers as well as any patient specifics about comorbidities and things of that nature.
Thanks to all of our guests for being with us today. We appreciate you as always, and thank you for being with us. Tomorrow it is open mics with Dr. Stites. Back to school is just around the corner, as we all know, and we're going to hear from Dr. Gerard, Chancellor of the University of Kansas, on what school could and will look like in the fall. We break down the impact of unvaccinated students returning to college campuses, so bring your questions. We're going to answer them. We'll see you tomorrow.